Hello, good evening everyone. Welcome to OET Speaking Speculation Live. This is me, Richard Caroline, joining you from Neethu's Academy. So yes, we are back here with another cue card discussion for you, especially exam model cue card discussion for you guys. And yes, for this is Wednesday, so we'll be doing the mock test presentation. And we have selected a very recent exam model card for the presentation as well. To say a few things about the card, this is kind of like an emergency department setting where the patient is approaching you and you are asking about the symptoms, you are understanding the present situation of the patient, and based on which you will be giving the possibility of the diagnosis, explaining what it could be, and giving some strategies about how it can be dealt with and what can be taken care of to improve his present situation. And also, it is a kind of like a common situation that you all are very familiar with. But like yesterday's card, നമ്മൾ ഇന്നലെ ലൈവിൽ ചെയ്ത അല്ലെങ്കിൽ ഡിസ്കസ് ചെയ്ത ഒരു കാർഡ് പോലെ തന്നെ ഇതിനും ഒരു റെലവൻസ് ഉണ്ട്. ബിക്കോസ് ഒരു കോമൺ കോണ്ടെക്സ്റ്റ് തന്നെയാണെങ്കിലും റീസെൻ്റ്ലി എക്സാമിന് ചോദിച്ച ഒരു ക്വസ്റ്റ്യൻ മോഡ് ആയതുകൊണ്ട് തന്നെ ഇറ്റ് ഈസ് ഇമ്പോർട്ടൻറ്റ് ദാറ്റ് യു നോ ഓക്കെ ദീസ് ടൈപ്സ് ഓഫ് ക്വസ്റ്റ്യൻസ് ആർ റിപ്പീറ്റഡ് ഓർ ദീസ് ടൈപ്സ് ഓഫ് ക്വസ്റ്റ്യൻസ് can be asked for the examination as well. So this is a very familiar context. As I told you, നമ്മൾ കാര്യങ്ങൾ ചോദിച്ചു മനസ്സിലാക്കുന്നു, based on which we are giving the proper diagnosis, possible diagnosis, and after that giving suggestions about what can be done, and also like എന്ത് ചെയ്യണം, ഇത് വേഴ്സൺ ആയി കഴിഞ്ഞാൽ എന്തൊക്കെയാണ് ചെയ്യേണ്ടത്, കൈൻഡ് ഓഫ് അങ്ങനത്തെ കുറച്ച് എക്സ്പ്ലനേഷൻ ഒക്കെയാണ്. സോ ഈ ഒരു പാറ്റേൺ അത്യാവശ്യം ഫെമിലിയർ ആയിട്ടുള്ള ഒരു കോണ്ടെക്സ്റ്റ് കൂടിയാണ് നമുക്ക് എല്ലാവർക്കും അല്ലേ. സോ ലെറ്റ്സ് സീ ഹൗ ദിസ് ക്യാൻ ബി പ്രസൻറ്റഡ്. സോ വി വിൽ ബി ഷോയിങ് ദ എൻറ്റയർ മോക്ക് starting with the warm-up session and all the other formalities and procedures that are included in the examination, and after that we'll display the role play presentation for you, and then towards the end we will have a detailed discussion about how this card can be done, how the sentence can be constructed, the transitions and everything that you need. Okay, so yes, good evening everyone, good evening. So without wasting much time, let's get started with this live segment. So over to the mock test presentation. Yes, so this is a recording of occupational English test conducted on the 4th of June 2025 at Neethu's Academy. The candidate's name is Amy K. Sebastian and the candidate number is 32568. The interlocutor's name is Richard Caroline and the interlocutor number is 3489. Good evening.
Good evening.
This is the recording of the profession of nursing. So please always remember, this is going to assess your proficiency, not your medical knowledge, so speak naturally. Okay?
Yes.
So can I please see your identification document, please?
Yes, here it is.
All right.
Thank you.
So yes, Emmy, we'll be starting with the warm-up session. Please keep in mind it is no way assessed, so speak naturally, okay? Yes. So could you please introduce yourself to me?
Sure. My name is Amy K. Sebastian and I hail from Kerala. I have a total of 7 years of experience, and the first 4 years I worked in neonatal ICU. Currently, I'm working in the pediatric oncology department.
Okay, and could you also please tell me about which is your favorite destination?
It is Australia.
Okay, can you tell me why?
Yeah, sure. First and foremost thing is that it has a world-class health system. Secondly, I would say the standard of living and the economy and political stability is much better.
Okay.
And another thing is that nurses are well paid and respected here.
All right.
Besides that, a number of my relatives and friends are there, and I believe they will help me during my initial days there.
Okay. So could you also tell me whether you have any role model?
Yes, I do. My mother is my role model. I actually follow a lot of things that my mother does. And it is her who inspired me or taught me the basics of a lot of things, which is kind behavior, politeness, humbleness, sharing mentality, organization skills, etc. And I'm always inspired by the way she makes decisions. And for me, she is actually an embodiment of perfect womanhood. And I believe that all these qualities something that a nurse should possess. So yeah, she's my superhero, I can say.
All right. So that's the end of your warm-up session. So we'll be starting with the first role play. So you'll have 3 minutes time to prepare. So in the meantime, if you have any questions, you can ask me and you can make the notes. And after that, we'll start with the role play. The recording will be for 5 minutes. Okay? So this is your card.
Thank you.
And your preparation time starts now. All right, Amy, that's the end of your preparation time. So your 5 minutes start now.
Okay. Good evening.
Good evening.
My name is Amy and I'm one of the registered nurses working in the accident and emergency department. How can I help you today?
Nurse, I've been experiencing severe stomach pain and I have no idea what is wrong with me, so I really need your help.
Okay, so you're experiencing stomach pain. Okay. Well, before we move further, could you please help me with your name and age for the documentation?
Yes, my name is David and I am 38 years old.
Okay, well, Mr. David. So, as we move forward, I would like to collect some details regarding your symptoms. Is that okay for you?
Absolutely.
Okay. So, could you please tell me when did the symptoms start?
It started today morning. I had my breakfast and after that 2 hours later I had a shake from outside and also a steak as well, and
Okay.
it started right after it.
Okay. Now, can you tell me the type of pain? Like, is it moderate, severe?
I do have really bad pain. It's kind of like excruciating. It's very
Okay.
sharp, I would say.
Okay, so in case if I give you a pain scale of 0 to 10, where 0 is the least pain and 10 is the maximum pain, where would you rate it?
Somewhere around 9ish.
Okay, that is quite severe, I understand. So, do you have any other symptoms?
Well, I also vomited.
Okay, so can you tell me the frequency and severity of vomiting?
Well, it was like I was throwing up my chest outside my mouth, and I vomited maybe 2 to 3 times.
Okay, I will make a note of that, Mr. David. But please don't worry. You're here, we'll take care of you. Okay, so do you have any other associated symptoms like a fever, diarrhea, dizziness, anything like that?
Well, I don't notice like I have a fever. My temperature is completely fine. I don't have any symptoms of that as well. But speaking about stomach disturbance, yes, I had an episode of diarrhea. My stool was not looking like the similar one which I have when it is my normal day. So I would say I do have some issues with that.
Okay, so we are experiencing diarrhea as well.
That's
Okay.
right, yes.
I will make a note of that. And now, for moving on, could you please tell me about your fluid intake? Like, do you experience thirst more?
I do, and I've been drinking a lot of water. It's kind of like unusual with me.
What about your urine output?
Well, no, that's kind of like normal.
Okay, dry mouth?
I have it, yes.
Okay, then I will make a note of that as well. Now, I would like to collect some information regarding your medical history. Like, can you tell me whether you have any pre-existing conditions?
No, I'm a perfectly healthy person.
Okay, that is good. And do you have any allergies? Like, any allergies?
Not that I know of.
Okay, well, Mr. David, thank you for providing all the necessary information. From whatever you said, I understood that the pain started in the morning and you're experiencing vomiting and diarrhea as well, and it is quite severe, and you don't have any other pre-existing medical conditions. Okay, thank you. And would you like to add anything else to this?
I think you got all the information right.
Okay, thank you. Well, based on whatever you mentioned, I think it is kind of a possibility. Everything is pointing to a possibility of food poisoning. So it is just a suggestion, it is a possibility. So in order to confirm that, you need to undergo a number of tests.
What kind of tests?
Okay, I will list it down. First of all, we will check your vitals. Then after that, you will have to undertake a blood test, urine test, and we'll also collect your stool sample. Is that okay for you?
Yeah, sounds all right. I'll do that.
Okay. In case if your symptoms are persisting, we might require imaging test as well.
Okay, that means if it get worse, then I'll have to undergo.
Yes, absolutely.
Okay, I
That's
understand.
okay. And do you have any questions or concerns regarding anything?
Yes, so you're telling me there is a possibility of food poisoning. So how would I know which is good for me and which is bad? What are the things that I need to keep in mind to avoid similar occurrences in the future?
Okay, so are you a person who eats food from outside usually?
Most of the time, yeah.
Okay, well, Mr. David, let me tell you, actually, I was about to give you some instructions regarding the same. So now, anyway, I will explain that. So whenever you take food from outside, you need to be very careful with it, especially if you are taking food from a street.
Okay.
Or if you're taking anything which is raw or undercooked, you need to be very cautious regarding that.
Okay.
And always look out for the hygiene of the premises or the restaurants from which you are taking food. That is important. And always ensure that your food is hot when it is served.
Oh, okay.
Okay, if you keep all these things in mind, it will definitely help you to reduce the frequency of these kinds of incidents. Is that clear to you?
Absolutely.
I hope you will follow that, right?
I will take care of it.
Okay. Well, Mr. David, I would also like to add one more point here. It is just that in case if your symptoms are exacerbating or it gets worsened, make sure you're seeking medical help immediately.
Got
Okay.
it.
Is there anything else that you would like to know from me?
No, nothing else.
Nothing.
You've been helpful. Yeah.
Okay, cool. So I hope everything is clear, right?
Yes.
Okay. Well, in that case, shall we move to the vital checks?
Yeah, sure, you can start.
Okay, well, that is good. Thank you. I will begin the vital checks very immediately.
Okay.
Thank
yes.
you.
So that's the end of your 5 minutes. Thank you, Amy.
Thank you so much. Bye.
Yes, welcome back everyone. So I hope you guys have witnessed the entire role play presentation and got an idea about how the sentences can be constructed for this card, how you can perform and coordinate the entire flow of conversation from this explanation. Yes, so yes, we'll start with the discussion here. So good evening everyone. Jubi, Angel, Ardra, good evening. Chinchu, good evening. Juliet, yes. Javita, Anjana, Ninu, Reba, Suma, Shini, good evening, all of you. Yes, so welcome back to another discussion of this card. So I hope you guys been noticing all the points and the way she executed the entire card. You notice the transitions, the interactions maintained, the acknowledgements used, the connections between each task and everything, the intro part, how she moved to the first task, and all these points. So yes, I hope all of you got an idea about how this can be performed, and I'm pretty sure you will also be very familiar with these concepts as well. Okay, so now let's look into this card one by one and try to decode and analyze it together so that we can learn more information from this and be ready when our exam is near. Okay, so yes, so it is given the setting is accident and emergency department, and when you read the background detail you can see that it is given your patient is complaining of stomach pain and vomiting after eating out. You see the patient in triage, so that means you're a triage nurse. Okay, so what you can do is you can start the introduction, since it is an unknown case for sure, because your first task is telling you find out the reason for the visit. So we know for sure without any confusions this is going to be an unknown case. Adila namukku clarity issues കാര്യങ്ങളൊന്നും തന്നെ ഇല്ല. So yes, we are taking it as an unknown case. So comment down the steps included in the introduction of an unknown case. എന്തൊക്കെ steps ആണ് include ചെയ്തിട്ടുണ്ടാവേണ്ടതെന്ന് പറയട്ടോ. And also there was a minor mistake in the mock test. Okay, I hope you guys noted it. It was in the intro part. There was one segment which was missed. So can anyone let me know in the comment section what was that segment? Okay, if you have listened very carefully and if you know what are required for the intro part as well, there was a very minute mistake. So can you tell me in the comment section what was ignored or what was neglected? Yes. Yes, Akhil, good evening. Happy to see you again, all of you. Yes, let me know in the comment section what was kind of like missed out in the presentation there. ഏതെങ്കിലും പോയിന്റ് അവിടെ പറയേണ്ടിയിരുന്നു എന്നുള്ള രീതിയിൽ നിങ്ങൾക്ക് തോന്നുന്നുണ്ടോ, ഏതെങ്കിലും മിസ് ഔട്ട് ആയിട്ടുണ്ട് എന്ന് നിങ്ങൾക്ക് മനസ്സിലായിട്ടുണ്ടെങ്കിൽ ലെറ്റ് മീ നോ. Yes, and also at the same time let me know the introduction for this context as well, how you are planning to start the conversation, how you are going to plan the entire greeting, the intro part, the verification, okay, the documentation process and things like that. Okay, so yes, make it fast. Let me know the comment section. Yes, Jubi, you have to greet, you have to give the self introduction, purpose of visit needs to be mentioned. Sorry, in this case, you need to ask for the purpose of visit, documentation, and lastly, I did not, yeah, documentation purpose. Okay, and fourth step is initial assurance. Very good, yes. That these are the steps included for the introduction. So, can you comment down which point among these five were missed in the mock test presentation? പെട്ടെന്ന് പറഞ്ഞു പോയപ്പോൾ ആ ഒരു പോയിന്റ് മിസ്ഡ് ഔട്ട് ആയിട്ടുണ്ടായിരുന്നു. And the reason why I am pinpointing to that again and again is because this is a common mistake that naturally happens to everyone. It can be accidental, it can be unintentional. നമ്മൾ അറിയാതെ വന്നു പോകുന്ന പെട്ടെന്ന് തീർക്കണം എന്നുള്ള രീതിയിൽ വരുമ്പോൾ നമുക്ക് വരുന്ന മിസ്റ്റേക്സ് ആണ്. പക്ഷെ ഇത് ക്രൂഷ്യൽ ആയിട്ടുള്ള ഒരു കാര്യമാണ്. ഇറ്റ് ക്യാൻ ആക്ച്വലി അഫക്റ്റ് യുവർ സ്കോർ ഫോർ റിലേഷൻഷിപ്പ് ബിൽഡിംഗ് ആൻഡ് തിങ്സ് ലൈക്ക് ദാറ്റ്. സോ ദാറ്റ്സ് ദ റീസൺ വൈ ഐ എം ആക്ച്വലി റിപ്പീറ്റിംഗ് ദ സെയിം പോയിന്റ് ഓവർ ആൻഡ് ഓവർ അഗൈൻ. സോ ഇഫ് യു അണ്ടർസ്റ്റാൻഡ് വാട്ട് വാസ് ദ മിസ്റ്റേക്ക്, സോ ഐ എം പ്രിറ്റി ഷുവർ യു വിൽ നോട്ട് മേക്ക് ദാറ്റ് മിസ്റ്റേക്ക് ഫ്രം യുവർ എൻഡ് വെൻ യു ആർ ഡൂയിങ് ദ കാർഡ്സ്. ഓക്കെ, സോ യെസ്, Jibi has mentioned, I think it's the IA. IA means initial assurance. Yes, that's right. So while doing the presentation, the candidate kind of like missed out the initial assurance. She said, okay, when I said I have a stomach pain and I need help, she did not offer help to me. What she said is, okay, I see you have stomach issues or some disturbances with your stomach. So moving on, can I please take your name? This is what she said. So she acknowledged my problem by saying, okay, I understand you have stomach pain, but there was no assurance, there was no help that was offered to me. So this can actually be reflected in your score for the relationship building because you're not developing a rapport with the patient right at the beginning itself. So it is important that you do give an explanation as in, I'll take care of you, or you have reached right place, please don't worry about it. You need to give that assurance. Along with that, you need to offer help as well. Okay, so this was the only minor mistake that she made. So make sure that while you are performing, you take care of this and you do the initial assurance no matter what. Okay, so that is how you will be performing this. So I hope it is clear to all of you. So now let's have a look at the second task. Find out the reason for the visit is the first one. So automatically when you do the introduction, you will be doing that too. Right? So you'll be asking the question, so may I know the reason for your visit? How can I help you? Etc. will be already performed, so you won't have to be worried about that. So the next question is, explore the symptoms in detail. So yesterday also we saw a similar task, and there also instead of find out, they used which word? Explore. When you had to ask about the symptoms of the child, if I'm not wrong, if I'm not mistaken, that was the card we did. So that case too, these both are kind of like exam model cards. So in that case also, instead of find out, they use the word explore. So you can understand they are repeatedly using this kind of like word. So you need to be familiar with what is explore and what is the context of that. So in this case, explore means find out. And what do you have to find out? You need to find out the symptoms in detail. Okay, so I told you yesterday, before you start asking questions, you need one thing to be done. What is that? Let me know in the comment sections. What do you have to do before you start asking the questions? And it was the same pattern that we discussed yesterday, so I hope you guys remember that. So let me know in the comment section, what is the main point that you need to do or you need to say before you ask the questions or start asking the questions. Yes, Suma Yadav, wishing, that is greeting, introduction, finding the problem, back channeling, acknowledge, and initial assurance. Okay, and also you need to get the name of the patient. Yes, this is correct. Yes, let me know what is the main point that has to be taken care of. I'm expecting a response from everyone. Yes, we discussed the same point yesterday as well. Before you start asking questions, this is a must, or this is kind of like a very important point that you need to include. So what was that? And I also mentioned this comes under the criterion called providing structure. And out of the 3 points they have mentioned in that particular point, this is the main one, or this is the first one if I'm not wrong. So yes, what is that? Yes, Suma has mentioned it is signposting. Excellent. It is signposting. So what do you mean by signposting? Signposting is the method that you use in the role play whenever you change into a different topic. That means whenever you move on to a different topic, you need to tell the patient, okay, this is what I'm going to do, or this is what we will be discussing right now, or this is what I'm going to explain to you right now. So you need to always showcase that to the patient. So this is done to maintain the clarity. So to maintain the intelligibility there, okay, so that the examiner, or in this case the patient, will not be concerned about, okay, what is she suddenly speaking about, or what is she trying to explain to me. Because when you tell the patient, okay, I'm going to ask some questions, the patient will be ready to answer your questions. The patient will not be confused or concerned, like, or shocked when you suddenly ask some questions out of nowhere without telling, or without taking the permission, can I ask you some questions. If you directly start with some questions, the patient or whoever is listening to you might be like, oh, you're wondering, oh, why she's asking me this question right now, well, like, why is it important that she knows this information. So in order to avoid these situations, and in order to maintain the clarity, it is significant, it is important that you tell the patient, moving on, I would be asking some questions to you about the symptoms, or I would like to know more about your symptoms, so may I ask some questions, is that okay? So then the patient would be like, okay, now I understand why you want to ask these questions, so it's fine, absolutely all right. Okay, so after the signposting statement, you need to be moving to the next point, that is a question. So yes, Javita, Jubi, signposting, I'm glad you guys remember it. Okay, now let's try to frame questions or draft questions for the points that we can see in the card. The first one is onset. So remember this point, remember what I'm going to tell you right now. When you do the speaking test, when you look at the card, you can see the word onset in two different contexts, okay? The first context is onset of symptoms. The second one is onset of an injury, okay? So if you're dealing with a card where they talk about accident or an injury, and you have the word onset, do not ask the question, when did it start? It is wrong. Accidents don't start, it happened. So what you have to do is, if it is about an injury or an accident, and if you have the question onset, frame your question differently. When did it happen? That should be your question. Now if it is about symptoms, symptoms do start, isn't it? They'll start to, there will be an origin, or there will be a starting point. So you can ask, when did it start, or when did you start to notice the symptoms, etc. Okay, so this is the major difference that you need to be always remembering about. So yes, coming back to the point, when it is onset, in this context you're talking about the symptom, that is the stomach pain the patient has been experiencing. So how would you draft the question? Let me know in the comment section, everyone. Yes, what is your question going to be? Yes. Let me know in the comment section, what is it going to be? Yes, Angel has mentioned, when did you notice the symptoms? All right. Okay, Suma has mentioned, yeah, Suma, I do remember that you asked for emergency department. Okay, I'm glad that it helped you. Yes, good evening all of you. Vami, I think your name is Vaminath. Okay, good evening. Yes, I would like to know more questions for onset. Is it just one way of asking, like, when did you notice, or when did it start? Is there any other ways to frame that question? Onset. Yes, you can give me the questions for the next one too. Type of pain. How would you ask the question for type of pain? If you want to ask the patient about the type of pain, how would you frame it? So Suma has mentioned, could you please tell me when did you first start having pain and vomiting? Okay, so if you're saying having pain, then for vomiting, you have to use another verb there. Okay, so could you please tell me when did you first start experiencing the pain and vomiting? Okay, yes. So Jubi, please tell me when did these symptoms started? Okay, so when you're using did, Jubi, you have to change the word started into start. Okay, could you please tell me when did these symptoms start? All right, very good. So give me the second question, type of pain. How would you rate, draft a question for that? Level of pain or type of pain. How can you ask that to the patient? Yes. Type of pain. When you want to know from the patient whatever pain the patient has been experiencing, how would you rate it? Yes, Angel, what type of pain do you have? Okay, what type of pain do you have is the right correct sentence. Okay, very good. Any other questions for type of pain? Now we can also ask about frequency and severity of vomiting. How can you frame a question for that? So in this context, it is important that you listen very carefully when you ask, may I know the reason for the visit? So the patient said, yes, I'm here because of vomiting. And the patient did not say anything about, the patient said, I'm here because I have stomach pain. And the patient did not say anything about vomiting. So you cannot directly ask the patient about, okay, can you tell me about the frequency and severity of vomiting? Because the patient did not tell you that, okay, he has vomiting as well. Okay, so what you have to do is like how she did, okay, in the role play, what you have to do is you have to ask like, okay, do you have any other symptoms like vomiting? Then the patient will be like, yes, I did vomit a couple of times, or I did vomit a couple of times. So then you will understand, okay, can you tell me about the frequency? Then it is okay to ask this question separately. But if the patient hasn't mentioned anything about vomiting in the card or in the role play, it is not possible, it is not right that you actually head into the conversation, ask like, okay, can you tell me about your vomiting? Because you don't know whether the patient vomited or not. So it's not the right way to deal with that situation. So always ensure that you listen very carefully when the patient speaks about the symptoms. Okay, so in this context, what you can do is you can separately ask a question like, okay, so do you have any other issues other than the stomach pain? So patient says, yes, I do have. Okay, I vomited a couple of times. So you already got a couple of times. So that is the frequency. So you can ask, so how severe is it? Then the patient will answer that question back to you. So this is how you can deal with that situation. Okay, now you have the next point, find out any other associated symptoms, fever, diarrhea, dizziness. So how can you deal with that? So you can ask, so Mr. David, do you have any other symptoms like fever, diarrhea, or any dizziness that you feel? So patient will reply to you that as well. Then you have one more point, inquire about his or her fluid intake. Okay, so since it is split into multiple tasks, it is not given together, it is kind of like different sentences. But what you're doing is literally asking questions. So what you have to do is in between just say, okay, so now about this, speaking about this, okay, I have a few more questions to ask you. അങ്ങനെ എന്തെങ്കിലുമൊക്കെ ഇടയ്ക്കിടയ്ക്ക് ഇൻഡിക്കേഷൻ കൊടുത്തിട്ട് വേണം അടുത്തടുത്ത പോയിന്റ്സിലേക്ക് പോകാൻ. അല്ലെങ്കിൽ it will look like you've been asking a lot of questions for a long time, so that might not be looking great. So what you have to do is you need to be adding these points like, okay, now speaking about your lifestyle, speaking about your health status, or now speaking about your fluid intake, okay, or asking about your fluid intake, now about your fluid intake. ഇങ്ങനെയൊക്കെ പല രീതിയിൽ പറഞ്ഞിട്ട് വേണം നമ്മൾ ആ ക്വസ്റ്റ്യൻസ് സെപ്പറേറ്റ് ചെയ്ത് ചോദിക്കാനായിട്ട് കേട്ടോ. Okay, so the next one is thirst, urine output, dry mouth. Okay, so do you feel thirsty? Okay, do you feel really thirsty? So how is your thirst? Did you notice any increase in your fluid intake? എന്നൊക്കെ പറഞ്ഞ് നമുക്ക് ആ ക്വസ്റ്റ്യൻ ചോദിക്കാം. Urine output. Okay, so how is your urine output? Okay, that is the question. Dry mouth. Do you have a dry mouth? Do you have a dry mouth? Okay, yes. So, yes, Nitin Alphonse, good evening. Jibi, and can you please tell me about the type of pain? Then, Suma, can you tell me about the type of pain like dull, severe, throbbing? Okay, very good. Angel, could you please rate the pain score? That's 0 to 10. Okay, Angel, if you're asking the patient to rate the pain, you need to give the rating, okay? So you have to say, like, if I give you a pain scale of 0 to 10, where 0 is no pain and 10 is the worst pain, how much would you rate it? This is the right question for that, okay? Then Angel, what are the frequency of the symptoms? Okay, can you please tell me about the frequency of the symptoms? Don't ask what are the frequencies, that is not right. Could you please tell me about the frequency of your symptoms? Suma, may I know about the frequency of vomiting? Okay, may I know about the frequency of vomiting is again not sounding very natural. So you have to change that. Okay, Suma, you can say, may I know how frequent you have vomited? May I know how frequent you have vomited? And the next one, have you noticed any other symptoms other than pain and vomiting? Vomitings illa, no, you don't have to say vomitings, it is vomiting itself. Very good, great questions, but just make these corrections and rectify the statements, okay? All right. Okay, so I hope all of you got an idea about these type of tasks. So now let's look at the next one. Question, task number 4, elicit medical history, pre-existing conditions, allergies. What do you mean by elicit? This is also an exam model action verb that you always, it's not kind of like very common, but at the same time it's a familiar topic. It's a popular one, but it's not very common. Okay, that's the right way to explain that particular topic. So yes, tell me what you mean by elicit. What do you mean by elicit? Yes? Anyone who knows the meaning of elicit? From the sentence, you might come to understand the meaning or the context. Yes. What is it? What is the meaning of elicit? Anyone? Okay, Juby has mentioned to get information. Yes, that means to draw information, okay? By certain prompts or by asking questions, you're actually making the patient give you some information. That is what is called elicit. So what you can do is you can ask a question about the medical history, okay? So you can frame a statement like, okay, Mr. David, now I need to ask you about some questions regarding your medical history. Do you have any pre-existing condition? So the patient said no, so you can reply, that's great, or I'm glad to know that. And do you have any allergies that I should know about? That I should know about is an additional thing, it is not necessary you have to add that, but if you want you can add that too, okay? So that is how we can ask these questions. All right, so yes, Suma has mentioned elicit means find out. Yeah, in a way it is find out itself. Jovita means to get response. Yes, elicit means to make the person to give you a response. That is a word meaning of elicit. Okay, so that is how we can ask all these questions. Now, once you have finished asking all these information gathering questions, what you need is you need to ask the question, do you, thank you for answering my questions. You need to summarize it. Okay, thank you for answering all my questions. From what you told me, I understand that you have been experiencing stomach pain and vomiting after eating out since morning. You have excruciating pain and multiple episodes of vomiting. You don't have any fever, but you have diarrhea. You are not tired, but you do have increased thirst. Your urine output is normal, but you have a dry mouth. No pre-existing condition and no allergies that you are aware of. Am I right? This is how we can give a summary, okay? So the patient would be like, yeah, you are right. That is how you can complete the entire task starting from task number 2, 3, and 4. Because all these 3 tasks are talking about information gathering. They're asking questions from the patient. Okay, Ardra has mentioned reaction. Okay, can you please clarify what you mean by that? I don't understand. Are you answering the meaning of elicit as reaction? Please confirm that, okay? So now let's look into the next point, which is confirm the possibility of food poisoning. So in this context, you're directly going to tell the patient, okay, so from what, based on what you have told me and your symptoms, I suspect you might have food poisoning. So you can see the word possibility is mentioned there. So that means it is important that you use the word might, because it is a possibility. We can't say you have this because we are not sure, we have not confirmed it yet. So it is important that you use the probable word, so that is might. You might have food poisoning, okay? And then you can move on to the next point. We need more tests to confirm it, however. Okay, however, we need more tests to confirm it. So we might need some vitals and vital checks, a blood test, urine test, and stool sample to confirm the diagnosis. I hope you understand. So the patient says, yes, I understand. Moreover, or in addition to this, or most importantly, please remember, it is important that we perform or we undergo an imaging test if your symptoms worsen. If your symptoms worsen, then that means that we need to undergo an imaging test. Okay, then you can ask, do you have any other questions, or do you have any questions to ask me? So the patient will tell you, okay, yes, I need to know about the safe food practices that I can follow. So you have your point, advice on food safety practices. So you can say, I was about to explain that to you. This is the exact same sentence what Amy did for the mock test. So what you can say is, okay, so I was about to explain that to you. That's a very nice acknowledgement statement that you can always use whenever the patient kind of like comes up with a concern and you really don't know what to say. In the acknowledgement, okay, that is easy. That is also an acknowledgement that you can try. Right? So you can say, I was about to explain that to you, Mr. David. So that's very neat and smooth. You don't have to worry too much about it. Okay. So you can say, I was about to explain that to you. So let's discuss some safety food practices. It is to be very much, and it is to be taken care of that you are very cautious while you're eating food from the streets. It is not advisable to have any raw or undercooked items because that can actually lead to food poisoning. And make sure that you're eating from a very clean environment, and also keep in mind that your food has to be hot when it is served. So don't try to eat any stale food. So be very careful when you're eating food from outside. I would encourage you to cook food for yourself, but if you don't get enough time, if you're eating from outside and if that is the only viable option for you, but keep all these points in mind. Okay. So this is an added point. നമുക്ക് അവിടെ ടാസ്കിൽ വന്നിരിക്കുന്ന പോലെ ഫുഡ് ഹോട്ടായിട്ട് സെർവ് ചെയ്ത് കഴിക്കാൻ ശ്രദ്ധിക്കൂ എന്ന് പറയുന്നത് വെച്ച് വേണമെങ്കിൽ നിർത്താം. ഇനി അതല്ല കുറച്ച് അഡീഷണൽ പോയിന്റ് പറയണം എന്നുണ്ടെങ്കിൽ, ഓക്കെ, മാക്സിമം നിങ്ങൾ തനിയെ കഴിക്കാനായിട്ട് ശ്രദ്ധിക്കുക, അല്ലെങ്കിൽ ഒറ്റയ്ക്ക് ഫുഡ് കുക്ക് ചെയ്ത് കഴിക്കാനായിട്ട് ശ്രദ്ധിക്കുക. ഇനി അങ്ങനെ പറ്റിയില്ല, നിങ്ങൾക്ക് സമയമില്ല എന്നാണെന്നുണ്ടെങ്കിൽ ഇറ്റ്സ് ഓക്കെ, ഡോണ്ട് വറി. കഴിക്കുമ്പോൾ ഈ പറഞ്ഞ കാര്യങ്ങൾ ശ്രദ്ധിച്ചാൽ മതി എന്നുള്ള രീതിയിലും പറയാം. ഈറ്റ് ഹെൽത്തി എന്ന് പറഞ്ഞാൽ യു ക്യാൻ കംപ്ലീറ്റ് ദ entire content there. Okay. Then you have encourage reporting concerns to authorities if symptoms persist. So you can ask, so I hope everything is clear to you. Having said that, I would like to remind you that if you have any symptoms that is troubling you so badly, or if you notice any worsening of the symptoms, please seek medical attention. Inform the authority kondu udheshikkunnathu medical attention edukku ennulla context aanu. So you can say that point. Okay, that's how we can finish the second last task. Then you can ask the patient, so I hope you got every point, or I hope everything is clear to you. I hope or do you have any concerns ennulla reethilakka question chodikam. So patient will be like, illa ella manasilayi, clear aanu, ningal ഒരുപാട് കാര്യങ്ങൾ പറഞ്ഞു തന്നു എന്നുള്ള രീതിയിൽ അവർ തിരിച്ച് റിപ്ലൈ തരും. So what you can do is, well, in that case അങ്ങനെയാണെങ്കിൽ, can I please start with the vitals? Can I please start checking your vitals, or can I start with my clinical observation എന്നൊക്കെ പറയാം. Okay, or can I have a look at your temperature, or if you want to expand you can say that too. So let me run some tests on you, let me do some vital checks on you എന്നൊക്കെ പറഞ്ഞിട്ട് നമുക്കത് സ്റ്റാർട്ട് ചെയ്യാം കേട്ടോ. So the patient will be like, yeah, that's okay. So you can wind up by saying, thank you for your cooperation എന്ന് പറഞ്ഞ് നമുക്ക് wind up ചെയ്യാം. So this is the overall idea of this task. I hope you got an idea of it. Okay, so this is how this common kind of a structure can also be presented. make sure that you practice these types of cards, because these patterns kind of like come back on track for the examinations. ഇന്നലെ നമ്മൾ ചെയ്ത എക്സാം മോഡൽ കാർഡും ഇന്ന് നമ്മൾ ഈ ഡിസ്കസ് ചെയ്ത എക്സാം മോഡൽ കാർഡും എല്ലാം ഒരേ പാറ്റേൺ, ഒരേ രീതിയിലൊക്കെ പോകുന്ന അല്ലെങ്കിൽ ഒരേ കോണ്ടന്റ് ഒക്കെ ഉള്ള ടൈപ്പ് ഓഫ് കാർഡ്സ് ആണ്. സോ മേക്ക് ഷ്യൂർ ദാറ്റ് യു ആർ വെരി ഫെമിലിയർ വിത്ത് ദീസ് കോണ്ടെക്സ്റ്റ്. ഓക്കെ, നിങ്ങൾ എത്രത്തോളം ഫെമിലിയർ ആകാൻ ശ്രമിക്കുന്നു അത്രത്തോളം നിങ്ങൾക്ക് ഈസി ആയിരിക്കും എക്സാമിന് പോയി നിങ്ങൾക്ക് ആ കാർഡ് കയ്യിൽ കിട്ടുമ്പോൾ വിൽ ബി ലൈക്ക് ഓക്കെ ഐ നോ ദിസ്, ഐ ബീൻ പ്രാക്ടീസിങ് ദീസ് ടൈപ്സ് ഓഫ് കാർഡ്, സോ ഇറ്റ് വിൽ ബി ഈസി ഫോർ മീ എന്നുള്ള ഒരു കോണ്ടെക്സ്റ്റ് നിങ്ങൾക്ക് ഭയങ്കര രീതിയിൽ ഭയങ്കര ഫെമിലിയർ ആയിട്ട് വരുമ്പോൾ നിങ്ങൾക്ക് ഭയങ്കര കോൺഫിഡൻസ് വരും. സോ ഇറ്റ് വിൽ ഡെഫിനറ്റ്ലി ഹെൽപ്പ് യു ടു ഇംപ്രൂവ്. ഓക്കെ, സോ ഐ ഹോപ്പ് യു വിൽ വർക്ക് ഓൺ ദാറ്റ്. ഓക്കെ, സോ യെസ്, താങ്ക് യു വെരി മച്ച് എവ്രി വൺ. Okay, thank you very much, Suma, for the kind words. I appreciate that. Okay, and I also would like to thank everyone for your constant support and for all the messages that you've been, I know you guys have been commenting down in the comment section. I've been going through everything. Great improvement, great sentences, all of you. So I'm glad that you guys are able to connect it with the previous topics that we are covering as well. Okay, so yes, that's all for today. Thank you all of you for your patience and your cooperation so far. So I'll be coming back next week, next Tuesday, with another exam model card. Until then, take care. Good night, all of you.